Hello everyone. Today we will discuss about correct and safe bed mobility for hospitalized or confined patients. What is bed mobility? Bed mobility is the ability of the patients to perform specific motions while in bed. Bed mobility can be affected due to weakness, decreased range of motion, or pain. Health providers assess the patient's bed mobility along with training the strategies and exercises to improve bed mobility. This presentation explains the strategies and exercises to improve bed mobility in patients with functional mobility impairment. Why bed mobility is important? Human bodies are meant to move. Limited mobilization leads to disuse muscle atrophy or a wasting of muscles and decrease of muscular strength. This can lead to increased difficulty with mobility. Decreased bed mobility can also lead to pressure ulcers. One of the preventive measures for pressure ulcers is positioning and proper bed mobility. Why are we learning bed mobility? For the safety of the patient from fall and further injury, for the safety of the caregiver and the patient who needs mobility assistance, it is important that proper body mechanics and safety precautions are always maintained. Different movements in bed mobility. These may include scooting up or down, scooting sideways, rolling over, twisting and reaching, lifting your hips, as in bridging, moving from sitting to lying down in bed, moving from lying down to sitting up in bed. How to prepare for bed mobility? Bed mobility motions require strength in different muscle groups. Assessment of the muscular and functional status before starting bed mobilization ensures application of proper techniques. Muscle groups that will be focused: quadriceps, hamstrings, gluteus muscles, calf muscles, shoulder and rotator cuff muscles, triceps and biceps in upper limbs. How can we start the bed mobility? First, figure out how much help the patient needs. Second, make sure that it could be provided safely and comfortably. The third one, prior to assisting with bed mobility. Fourth one, consider the following important checklist and safety tips. Important checklist and safety tips before bed mobility. The first one, clear the area and have needed equipments in your reach. The second one, if there are any lines, tubes or catheter, ensure it would not interfere with the bed mobility activity. Third one, decide which side of the bed the patient should get out from based on their strength, comfort and ease of transferring. The fourth one, position yourself to that side of the bed where the patient would roll towards you. The fifth one, if the bed is adjustable, adjust the height to approximately to your hips level. Sixth one, if the bed has rails, please lower them on mobility side. Seventh one, inform the patient what to expect. Involve the patient as much as possible. Give clear direction before and during activity. Eighth one, give clear directions. Sometimes counting from 1 to 3 allows the caregiver and patient to work together. Patient safety tips during bed mobility. Avoid forcing or pulling on the patient's extremities. Assist the patient on their weaker side. Minimize sharing forces on the skin. If applicable, maintain all precautions set by the physician. If you are ever unsure, get needed help. Important bed exercises to be practiced before doing bed mobility. Static quadriceps, static gluteal exercises, straight leg raise, hip abduction and adduction, hip and knee flexion, ankle dorsiflexion and plantar flexion, bridging, bend knee fallouts. Static quadriceps. In this, put patient's legs out straight in the bed in front of him. Pull his foot up towards him and push his knees down into the bed. Remember to exercise both legs. One set of 5 repetitions. As a progression, place a roll under the knee. Repeat the same. Static gluteal exercises. Keep patient's legs out in front of him. Contract your bottom muscles, making sure he don't tense his legs or stomach up muscles. One set of 5 repetition. Straight leg raise. Bend one knee up so patient foot is on the bed. Straighten his other legs and lift off the bed a few inches. Then slowly relax the leg back down. Repeat it 5 times. Hip abduction and adduction. Put patient's legs out straight in front of him. Slide your leg out to the side and back to the middle. Repeat it for 5 times. Hip and knee flexion. Bend the patient's knee up in front of him, keeping it in midline to his body. Bend it up as much as he can, then slowly lower back down the bed. Repeat it 5 times. Ankle dorsiflexion and plantar flexion. Ask the patient to pull his foot up towards as much as he can. Then ask him to point his foot away from him. Repeat on the other leg also. One set of 5 repetitions in each leg. Bridging. Ask the patient to bend his knees up so his feet are flat on the bed. Using his bottom and leg muscles, raise the buttocks up off the bed, pushing equally through the both legs. Keep the pelvis level. Slowly lower back to the bed and repeat it 5 times. Bend knee falls out. With the patient's knees bent up on the bed, slowly lower one knee out to the side and bring it back to the middle. Make sure your other knee stays in the middle when lowering the opposite leg out to the side. Repeat it 5 times. What are the steps to accomplish safe bed mobility? The following steps are for getting out of bed. The leg closest to the edge of the bed can be straight or bent. Have the patient bend the opposite hip and knee. Place your hands behind the patient's shoulder and hip or thigh on the far side. Have the patient reach with their opposite arm across their body towards the side of the bed. Important tip, the patient should always roll towards you, not away from you. Getting out of bed. Assist the patient in rolling towards you and have them use their opposite arm to reach across their body into the side lying position. The patient should place their arms in a position that is comfortable for them, that allows the patients to use their arms and upper body strength to help push up to a seated position. The patient should now be lying on their side with the hips and knees bent. Getting out of bed. Have the patient move their legs off the edge of the bed. If needed, you can assist the patients to move their legs from the behind their knees. The patient can use both arms to push up to help achieve a sitting position. If needed, assist the patients to achieve a sitting position by placing one arm behind their shoulder. The other arm could be placed behind the other shoulder, supporting their trunk or on the patient's pelvis. Important tip, if assisting the patient, perform the activity in a continuous smooth motion. Always take your time, do not rush. Sitting to standing. To help the patient move from sitting position on the bed to a standing position, first assist the patients to scoot to the edge of the bed. With you as standing in front of the seated patient, the patient leans to one side while you support the shoulder on that same side. With your other arm, help the patient shift the hip forward. This process would be alternatively repeated on the opposite side. Sittings to standing. Make sure the patient's feet are flat on the floor and he or she sits for a few seconds before leaning forward to the assisted to a standing position. If the patient is preparing for standing, have them lean forward, keeping both their hands flat on the bed or on their lap to assist with pushing off the bed during the transition from sit to stand. Let's see a video. Sitting to standing. The steps to transition from sitting to lying on the back as follows. Have the patient sit on the bed and away from the edge, which allows less repositioning once in bed. Assess the patients as needed to get into sideline position. Have the patient bend both knees and roll into their back. Assess patient as needed. The patient can scoot in bed to adjust to a comfortable position. Assist patient as needed. Bed mobility sitting to lying video. Thank you for listening.